Hi, everybody. Today's lecture is going to be on how to read an ECG. Please do keep in mind that this is for very basic overview of the ECG for a lower division biology class. So there are details that are missing both in terms of what are the components of the ECG as well as how to read it in a more detailed clinical setting. So what we're going to start with is understanding what is actually ECG. But for that, for us to understand that, we first need to understand that your heart has its own electrical impulses, which are referred to as intrinsic conduction system. Intrinsic implies internal. So basically what we have is a group of non-contractile cells that have placed strategically throughout the heart with the goal of creating electrical impulses, which leads to muscle contraction. And in this case, since the contraction comes from cardiac muscle, that basically gives you your heartbeat. So simply put, electrical impulses created by what we describe as intrinsic conduction system causes your heart to create heartbeats. Now, what are these intrinsic conduction systems? The first one that triggers or initiates the electrical impulse in your heart is called cyanoatrial node or SA node, which is again a cluster of non-contractile cells located at the superior part of the right atrium. So you can see it right here. Now, this is also known as the pacemaker of your heart, since the number of electrical impulses created by your SA node also basically means that's the number of times your heart beats. So in average, your heart, or more specifically your SA node, can create between 60 to 100 electrical impulses per minute, which gives you a heartbeat between 60 to 100 beats per minute. Now, SA node passes its electrical impulse to the next cluster of non-contractile cells located between the right atrium and the right ventricle, known as the atrioventricular node. And again, you can kind of localize it in terms of its placement right here, right, again, between the right atrium and the right ventricle. Now, electrical impulse is going to continue going down through your heart, passing through a structure called the AV bundle. AV bundle, also known as the bundle of His, that allows the electrical impulses to further travel into the ventricle. And it's, as you can see it in the picture, it's passing through the septum. This portion right here, that would be your atrioventricular bundle or bundle of His. Again, if you continue looking at the picture, you notice that it is branching some point within the septum, and these smaller branches that are formed are called bundle branches. Again, this is ensuring that both left and right ventricles are receiving electrical impulses, which leads to contraction of the ventricles. Now, the last branching that you see, which are the smallest of the electrical impulses pathway or structures within this pathway, are called Purkinje fibers. These are basically going to allow the electrical impulse to rapidly spread through the ventricles. And you can see them as these much smaller branches in our picture. So if I ask you guys, write the path of electrical impulses through the heart. Again, it starts with SA node, continue to AV node, AV bundle or bundle of His, bundle branches, and then eventually to the smallest branching called the Purkinje fiber. Now, ECG stands for electrocardiogram. And the picture or the strip that is created as a result of this machine is called electrocardiograph. Basically, you are creating an image of the heart electrical impulses, if you want to kind of break it down for yourself. Now, ECG, again, is measuring specifically the electrical impulses of the heart as it passes through. Now, there's two, if you want to put that on, I'll put that in code. There's two different versions of the ECG. The first, which is the one that we're going to use, basically is the simplest version of ECG. And it's going to basically allow us to connect an electrode to the right arm, to the left arm, to the right leg and the left leg. And through this, basically measure the electrical impulse that is passing through your heart located right here. Now, the more complex version, if you want to say, that is typically utilized in a hospital is referred to as a 12-lead ECG or EKG, which basically places multiple electrodes going toward the left side of the body, and it allows you to get a better picture of the heart activity and heart health. Again, for our setup, we're only going to use 3 main leads, which is this one, your right arm, your left arm, and your left leg. And this one, which is your right leg, is actually ground. So there is no actual electricity or recording of data comes from that one. Again, how is that data collected? The more physics behind that, I'm not getting into that. All I need you guys to understand is that when I connect these 4 electrodes to my subject, I will create something that resembles this, which is called an ECG. Now you will get quite a few of them depending on the heartbeat. So if you have, let's say a person has a heartbeat of about 70 beats per minute, if you look at your strip, these are spread out, these ECGs or patterns are spread out a little bit. But if the person's heart rate is higher, then these ECGs or pattern will be closer together. Again, kind of think about it logically. The higher your heartbeat is, the more of these electrical impulses will be created, and therefore they will appear closer to each other. Now, what are these structures that I'm actually looking at? So let's just start with the 3 most important ones, which are your P wave, the first one. What we see here as this large peak, which is your QRS complex, and then another wave at the end, which is called the T wave. Now, P wave by itself represents your atria getting ready to contract. So this is implying the electrical impulses are passing through the atria and are eventually going to cause basically the contraction of the atria. QRS interval, which as you can see, also called the complex, is the largest of the complexes we have within the ECG. It represents your electrical impulses that are passing through the heart and allowing the heart to start or initiate its contraction. Now, the last part that we see, which is a very visible structure, is a T wave. T wave is basically representing the process called repolarization. You don't really need to know the word, but basically that repolarization allows the ventricles to relax back to normal. Now notice I didn't mention anything about atria relaxing. So we basically have atria contracting, correct? Atria contracting, ventricles about to contract, and ventricles are about to relax. But from this ECG, we do not depict, or basically your electrical impulses is not demonstrated for the atrial relaxation, because when atria is about to relax, your ventricles is about to contract. So both of those are happening somewhere here. But again, because the QRS is a much larger complex, it overshadows the atrial relaxation. So don't look for it, it shouldn't be present. Now, in addition to the typical waves or complexes that are present on an ECG, you also have what we identified as intervals. So what we have here is the first one, which is called the PR interval. It starts from the beginning of the P all the way to the beginning of the QRS complex. And this is basically depicting the communication from the SA node to the AV node. Again, remember, SA node is the first one that initiates the process, and AV node would be the second one in the row. So for that electrical impulses to travel from one location to another, that is depicted in terms of time with the PR interval. We also have something called the ST segment. ST segment is the end of the QRS complex to the beginning of the T wave. So this region represents the depolarization of the ventricle. So basically you're finishing up the process, and again, you continue with relaxation afterward. We also have something called the QT interval, which is right here. This is including your QRS complex as well as the T wave, and it basically represents your ventricles are starting to contract and ventricles are finishing with their contraction, or about to contract. Oh, sorry, about to relax, I should say. So when you're looking at the QT intervals, you're focusing on basically this word depolarization implies your heart is about to contract, and repolarization is basically implying that your ventricles are about to relax. So that is also something else that can be measured. Now the question is, why do I care when measuring these? These are extremely important for us to be able to understand if the heart is working properly, if the electrical impulses are passed properly throughout the heart. Is it part of the heart that is not receiving the electrical impulses, and it would be depicted as changes or missed waves or complexes on the ECG. So it is important to know these components and be able to measure them. Now, in terms of what we want to study, in terms of your ECG, is we have what we identified as 5 cardinal rules. And these 5 cardinal rules, I've listed them as individual slides. So one is interpretation of the rhythm. I'll go over it and then we'll go over the example. Is your rhythm regular? As in, are they your R to R complex or intervals are the same? So basically from this peak to this peak, am I looking at the same distance? Or is it irregular? Now, irregular means it can be regularly irregular. It means all the time it is irregular. Or you can have irregularly irregular, as in you can have a continuous irregular pattern all the time. And there is no, basically, you won't see any observed pattern on it. The second thing that I'm concerned about is, or second rule that I want to basically assess my ECG based on, is heart rate. So heart rate needs to typically be between 60 to 100 beats per minute. And I can use 3 separate methods to accomplish that. One we identify as a 3-second rule or 3-second method. One is a 6-second method. And the other one is what we identify as a R to R method, which requires a little bit of calculation. The other thing that we look as is each of the P's are continued or followed by a QRS. And remember, the P is atria about to contract. QRS implies that ventricles are about to contract. So basically, I want to see, is every time my atria sending an electrical impulse, does that electrical impulse reach my ventricles? So is there proper communication between my atria and ventricles? Another cardinal rule in assessing ECG is looking at what we identify as PR interval. Again, PR interval is important because it shows if the electrical impulses are properly conducted from the initial signaling, which is your SA node, passing through your AV node. So again, if there is some sort of problem, sometimes referred to as a block, or blockage, then the communication between the SA node and AV node will be interrupted, and you will not see the proper timing that is depicted. And last one is the size or time it takes for the QRS complex to be created. Again, QRS complex is basically how long does it take for the electrical impulses to spread throughout your ventricles, and it basically tells you how fast, again, the electrical impulses are going from AV node all the way to the Purkinje fibers. Again, how fast the electrical impulses are spreading through the ventricles that leads to the ventricle contractions. Now, again, keep these in mind. We'll come back and look at them one at a time. Now, last thing I want to talk to you guys about is, well, not last thing before we start looking at the examples, is how to actually read the ECG papers. What are those little boxes imply? So this is a little bit of a math involved, so please be careful and make sure you guys are following. Again, if you guys do have any questions, bring them up when we have office hours online. So ECG papers is made up of these squares. So typically this ECG paper would be in pink color, and the little square would be on a light pink, and the darker squares that you see would be basically kind of reddish color. But again, here in this picture, you don't see that. But if you're looking at the pictures that I posted and we're gonna assess, you can see dark red line and then little pink boxes inside. So now, the vertical boxes or columns of boxes going after one another, going this way, has a meaning. But for our purpose, we're only gonna be looking at the horizontal or going across the ECG and assessing that aspect of it. And again, if you need more detail, you're welcome to either come and talk to me or look at other resources. But let's talk about the horizontal axis of your ECG. This is representing time. So as you can see, it says, for instance, this is representing 3 seconds. So how did we get that 3 seconds? So if you look at your ECG paper, you have these larger boxes. And within these larger boxes, I kind of zoomed in this picture, you will see that it is formed of 5 little boxes going across. So this is basically this picture right here. So we're zooming into one of these larger boxes. Now, each of these tiny pink boxes that I have, there's 5 of them going across. So each of these by themselves represent how much time? 0.04 seconds. Not 4 seconds, guys, 0.04 seconds. So if I put 5 of them in the row, I will have what? 5 times 0.04. So 5 times 4 is 20. And that would be basically 0.2 seconds. So basically, if I'm looking at the smallest boxes, that's 0.04. If I'm looking at the big boxes, so from here to here, that is depicting a 0.2 second. And you can see it right here. So now, what if I put 5 of these larger boxes together, as you can see here? So see 1, 2, 3, 4, and 5. So I have 5 of them, and each of the boxes I said is 0.2 seconds, so 0.2 seconds. So that would add up, so 5 times 2 is 10, so it would be 1 second. And you can think about decimal places. I'm not getting into the math part. So basically, from here to here, this is representing what? 1 second. So the smallest box I have is 0.04. The large boxes that I have are 0.2. And if I put 5 of those large boxes together, I get what? 1 second. So logically, think about this, guys. If I have 5 of them represents 1 second, this 5 is gonna represent my second second, And 1, 2, 3, 4, 5, that represent the third second. So from basically in this ECG, from here to here is representation of 3 seconds. What if I want to do 6 seconds instead? So all I need to do is what? Count 15 more boxes, which I don't have on this side, but count 15 more boxes, and that adds up to 6 seconds. Now, we're gonna go ahead and get started on assessing our ECG, but I'm gonna start with looking at a picture and how you actually label each of the components. This is a good practice for you guys to be able to identify components as we go through the 5 cardinal rules. So right here, this is a structure that I have. This is my P wave. This big complex that I have, this is my QRS complex. And then this last one I have, this would be my T wave. As you can see again, P wave, QRS complex, and T wave. Now, what is my components that I need to recognize in addition to that? I have what we identify as PR interval, which again starts with the beginning of the P and ends with the QRS. So this is my PR interval. And we have something called the QT segment, which in this case starts from here, where I ended the other one, and it goes all the way to the end of my T. So this region right here would be my QT interval. And there are segments, but we didn't go into that, so I only want you guys to know these. And again, understand, as we went over already, the importance of each of these components. So let's go ahead and take a look at our data. Now, this is not the data you have received in your homework. It is a practice one, so I can walk you guys through it, and then you guys can use that information to complete your own assignment. So interpretation of the rhythm. Is the rhythm normal? Again, how do I look at that? I'm gonna look at the time span between each of the R to R intervals and see if that distance is the same, or the time basically. So let's see. So from here to here, there's 4 boxes. From here to here is almost 4 boxes. And then here I have 1, 2, 3, and then 3 and 3, which add up to about 4 boxes again. And you can see again 1, 2, 3, and then a little bit of the 3 box, the 4th box here, and a little bit of it here. So basically, if I'm comparing this distance to this distance to this distance, what I notice is that the distance is the same for all of them. And again, you guys can continue going over this. So in that ECG that I'm depicting here for you, the rhythm will be identified as normal or regular. So this is what I would choose if I'm looking at my rhythm. How would an irregular rhythm would look like? So let's see, you have your QRS T wave, and then you have a big gap, and then you have a gap there. But let's say this is your next one, right? And then the next one happens like this. And then again, you guys have a gap, and imagine again like this. So notice again, here in this picture, and again, is this an actual ECG? Of course not. But would you see possibly a rhythm that looks like this? And the answer is yes. So look, if I was comparing this, the difference between these 2 peaks, this would be the time versus this versus this. Again, notice these distances are not the same compared to what I showed you here. So this would be identified as irregular. Now, I don't have enough data to say if these are regularly irregular or irregularly irregular. And I don't expect you guys to do that anyway. As far as you can tell me, The rhythm is regular, the rhythm is irregular. We're happy with that. Next thing we're gonna do is we're going to use our 3 methods to figure out the heart rate. So again, normal heart rate, make a notation for yourself if you already forgot. Normal heart rate is 60 to 100 beats per minute. So we're gonna use the 3-second rule first. Now, if you guys recall from our, like 5 minutes ago, we said one of these large boxes by themselves, it's about 0.2 seconds. So if I put 5 of these together, that gives me 1 second. So 1, 2, 3, 4, 5. So this is 1 second. I'm gonna repeat that one more time. 1, 2, 3, 4, 5. That's my second, and then 1, 2, 3, 4, 5. That's my 3 seconds. So from here to here, this is 3 seconds. And what I'm going to count is how many R peaks do I have within these 3 seconds. So here is my first R peak, here's my second R peak, and here's my third peak. So I'm gonna say there are 3 peaks, right? Now, where does this 20 come from? So think about this, guys. In a 60-second, how many in a 60-second, how many 3 seconds can I fit? In a 3-second, or in a 1 minute, which is 60 seconds, how many 3 seconds can I fit? And the answer is 20. So I'm gonna multiply that by 20. So that gives me my heartbeat to be 60 beats per minute. Now imagine, again, like I'm just giving you a different scenario. So let's say I had a scenario like this. I'm just gonna kind of depict the same thing for you. I have something like this. I know it takes a little bit longer for me to do this, so. Whoops, we missed a beat. So now, same time, right? Same time, we have 3 seconds, but look, now I have 1 peak, 2 peak, 3 peak, and 4 QRS peaks. So I would say in that case, I have 4. I still have the 20. So now my heartbeat is 80 beats per minute. Now, is this the most accurate way of measuring heart rate? No, of course not, because imagine I had a peak right here, or I counted 2 boxes that way. Or I started counting from here and my 3-second ended here. Then I would have the 4 peaks in here giving me 80 beats per minute. So it is not the most accurate way of measuring heart rate, but it is an ideal way if you are trying to kind of rush through and get an idea about the heart rate. And again, if you look at these, hundreds of these throughout your career, it's pretty easy for you to spot what the average heart rate would be. Now we're gonna repeat the same process, but instead of looking at only 3 seconds, we're gonna expand it to 6 seconds. And again, if you're looking at 6 seconds, you have 10 6 seconds in 1 minute. 10 6 seconds in 1 minute. So keep that in mind. So my multiplication, instead of saying I multiply that by 20, I'm gonna multiply them by 10. Because previously I have 23 seconds, now I have 10 6 seconds in 1 minute. So let's count our boxes. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So from here to here, this is 3 seconds, right? And then again, if I repeat this, from there to there is 3 seconds. So this is 15 more boxes. So basically here to all the way to here, sorry, my pen just kind of moved. is total of 6 seconds, which is what I want. Now again, count the peaks. 1, 2, 3, 4, 5, 6, and 7. So I'll take 7 and I multiply that by 10, and that gives me a heartbeat of 70 beats per minute. What's the last one that we're gonna do? That's called the R to R method. This is going to be the most accurate way for us to measure the heart rate on our ECG. It says ECG, but this is the same thing as EKG. So it says EKG, but it's the same thing as ECG. And in order for us to do that, we're gonna use this equation. So I'm gonna walk you guys through this. First thing I want to measure is how long does one heartbeat takes. So one beat takes how many seconds? So let's say I'm gonna take an easy one for me. So I'm gonna say, I'm gonna pick this heartbeat from here to here. So I'm gonna pick from one R, from one R peak to the next R peak. So we know each of these big boxes that I have are 0.2 seconds, right? And I have 1 box, 2, 3, and 4 boxes. So 4 of these boxes, and each of them are 0.2 seconds, right? So my R to R peak is 0.8 seconds. So basically what I'm saying is one beat took 0.8 seconds. So how many beats can I fit in my 60 seconds, which is 1 minute? So solve for X. X beats is equal to 60 times 1, right? Crisscross it, divided by 0.8 seconds. So it's a simple calculation. Divide basically 60 by 0.8 seconds, and it should give you 75 beats per minute. So kind of look at this. I think it's really fascinating. So the first one that we did gave us a heartbeat of 60. The second one we did gave us a heartbeat of 70. And the most accurate way is actually saying my heartbeat is about 15 beats more than what I originally thought, which is actually 75 beats per minute. Now, this is interesting. Again, this is going to R method is going to be the most accurate way of us measuring our ECG. So for you guys, again, you have an ECG on your lab assignment. So all you need to do is pick up one of the R to R waves and do the calculation that I've shown you here. Now, the next cardinal rule that helps us assess our ECG is, do we have 1 P to every of the QRS, or do we have 1 QRS for every P wave? That means basically, again, P wave was identified as our atria about to contract, and the QRS complex is our ventricles are about to contract. So basically, I want to say, do I follow every atrial contraction with a ventricular contraction? So let's take a look. So I have P, QRS, T, P, QRS, T, P, QRS, T, P, QRS, T, and etc. So every P is followed by a QRS complex. So my answer would be yes. In this scenario, again, I do have that. If you have something like a heart block, sometimes you may see something like this. So you will see a flat, a QRS, a T wave, then you see a P wave, your QRS T wave, then again nothing, a QRS complex, maybe a T wave, and then continue. So look, in this picture, my P waves are missing. So again, is this going to happen all the time? No, sometimes a person will be missing most of them, sometimes only a few of them. It depends on the level of the heart block. There are different types of heart block. So this, depending on the severity, the person may basically go untreated for a while, versus no, they need to have the surgery and they need to have a pacemaker to resolve the problem. Now, fourth rule we have, fourth cardinal rule for assessing our ECG is looking at the PR interval. Again, PR interval starts from the P and ends with the beginning of the QRS complex. And this interval again shows how the electrical impulse is moving from the SA node to your AV node. Now I changed this picture and I show you a different picture because it's easier for me to depict it, but you could have as easily, if you want to get some practice, see if you can figure out your PR interval on the picture I have shown you here. Just for the simplicity of our lecture, I'm showing you on a kind of a larger, enlarged image here. So PR interval in this case, it starts from right here, which is the beginning of the P to the beginning of the QRS complex. So each of the boxes, again, kind of reminding you guys, this big box is 0.2 seconds, and each of the tiny boxes inside of this is 0.04 seconds. So let's see. I have one full box, and I'm gonna just put a number on it. One full box, two full box, and then half a box here and about half a box here, giving me a third box. So basically I have three small boxes. Each of these small boxes are about 0.04 seconds. And if I multiply them together, that gives me 0.12 seconds. Is this acceptable range? Is this acceptable time for the PR interval based on information? Yes, because PR interval should be between what? 0.12 and 0.2 seconds. So yes, this is normal. Again, if the time is less or more, that means there is a problem with the heart in terms of conduction of electricity from the SA node to the AV node. Last rule that we're gonna look at is the time it takes for the QRS complex to be formed, or your QRS interval. Again, this is important because it tells us if the electrical impulses are spreading effectively through your ventricle. Basically, is the electrical impulses passing from AV node to the Purkinje fiber, which is electrical impulses of the ventricle. Now look at the time, guys. This is a pretty fast process, right? This is a speedy because you want the ventricle to contract as one unit rather than, oh, let's contract half of the ventricle and then we'll contract the rest later. So what does that imply in terms of looking at our picture? So again, I'm gonna start from the beginning of the QRS to the end of the QRS. So to me, this is half a box on this side and half of the small box on this side, which gives me a 0.04 second time. Now, what is that? Is that an acceptable number? Look at the number. It's 0.04 to 0.12. Basically, a small box, if you want to kind of look at it in the layman's term, to the maximum of 2.5 of the small boxes. So not much in terms of the space, right? For us, it was only one box, which is 0.04 second, which means our QRS interval within the normal range, as an electrical impulses are effectively spreading throughout the ventricles. So that is it for our lecture on the ECG. If you haven't done so already, please make sure you download your ECG homework from your files. Work on it. There is an actual new ECG for you on your homework, and then make sure you guys submit it by the due date. If you have any questions or concerns, email me or discuss that with me during office hours. Thank you.